Hello dear friends, this is a case of an 80-year-old male patient with a known history of abdominal aortic aneurysm, which was repaired 2 years ago and now presents with severe abdominal pain and right lower quadrant tenderness. CT aortogram was performed to rule out any possible leak or rupture. So let's scroll the images and let's see the findings. Once more, a little further up to make your first impressions. First of all, we can see the endovascular repair with the grafts. We can see the aneurysm, and most importantly, we can see that there is a rupture. All this area around the abdominal aorta, which shows fat stranding, and these appearances are compatible with a retroperitoneal hematoma. It's very important. We can see that the anterior contour of the psoas muscles is obscured. There is blurring around the contour of the vessel, particularly in the posterior aspect, is also obscured. So this is definitely a retroperitoneal hematoma. We have a rupture here. But another interesting point is that this is the arterial face, and we can see that there is an arterial blush here, as you can see. Here is the bifurcation with the stents, and at this point exactly there is an arterial blush. And what could this mean? Probably this is an endoleak laterally to the stent here, which may raise the intraluminal pressure inside the aneurysmal sac, causing the rupture of the aneurysm. Now, as for endoleaks, there are 5 different types. We may discuss it in a different video, but this type of endoleak probably represents type 3 or type 4 endoleak, resulting in this aortic rupture. Of course, there is intraluminal thrombus, which shows inhomogeneity due to the leakage. This is IV contrast. Let's scroll the images once again. Dear friends, thank you for watching this interesting video. Please subscribe to my channel if you find my videos interesting and tutorial, and see you soon the next time. Thank you.